Hi guys, welcome back to another video of Educate channel. So today we will be analyzing the ICR PG exam 2022 Veterinary Science. So the rank list has come and the allotment has started. So we will be just going through the question paper, or we will be going through the weightage of the question paper this year. So please subscribe and hit the bell icon for more updates. So we have got 120 total questions, and 120 questions will be having from all subjects like first year, second year, third year, and fourth year. So this is actually the question section from veterinary science. That is, from the first year we will be having veterinary anatomy, and from the fourth year we will be having gynecology, medicine. That is both clinical medicine and preventive medicine, and veterinary surgery radiology. And from the third year we will be having veterinary parasitology, veterinary pharmacology, and veterinary public health and epidemiology. And from the second year we will be mainly having microbiology and pathology. And also we have got like in the as mentioned in the ICR notification, we have got wildlife science and wildlife health management questions, but very rarely questions will come from that. Or like it comes from like mixed with clinical subjects of the clinical medicine and wildlife management together. So moving to 2022 question paper, there were 17 questions from anatomy and 10 questions from gynecology, and from medicine 11. Parasitology it was 19, pharmacology it was 19, pathology it was 11, and according to me that's like a wildlife science, wildlife health management, there was no questions. And from VPH also there were no questions. BMC microbiology is 90, surgery is 14. Actually, we have made this classification, we have made some adjustments, that is structures of the reproductive organ and all we have included in the anatomy section, which can also be asked in the gynecology section. See the structure of reproductive organs, all those questions are classified into anatomy, not gynecology. And also anything which comes with these vaccines, bacteria's name are all classified into microbiology questions. And anything which comes with anesthesia or bone formation is actually classified into surgery, not into anatomy. And not actually, we have called a unit that is veterinary anesthesiology in pharmacology section also. But we have included all those anesthesia questions in the surgery questions. We have got some questions which is having like the tick, mechanical vectors and all, which can also be classified into veterinary public health zoonosis question, but we have classified them into parasitology because whenever we are saying any mechanical host or mechanical vector or any parasite's name, we have classified it into parasitology questions. So moving to the tips, that is actually, first of all, we have to study according to the weightage because we have got some idea from the previous ICR question papers and all. Every subject has got much weightage in the ICR question pattern. So we have to move into that weightage and we have to study according to the weightage. And we have to revise and make short notes because making short notes, we can easily brush up all those things when the exam is coming very near. So make short quotes or mnemonics. That will be very easy to remember all those classifications of the drug, classification of the bacteria, all those tests and all. It's very easy when you are remembering mnemonics. Now do some practice questions because everybody is busy into the theory learning section, but also to prepare very well in an examination with a very short time, we have to practice questions. We have to be very familiar with the questions and all. So we have to practice many questions as possible. So read standard books because 2 3 years back, ICR was having questions with like MCQ section only. That is not MCQ section. That means if we have studied some books and all, we can easily get a good score. But now the question pattern has changed. Even they have asked like assertion based questions, which is very difficult to answer unless you are not fit upon to the theory. So if you are having much better theory, you can easily answer those questions with your theoretical knowledge. Also, you have to have a good enough fast section to write the answer in a very short time. So next is actually never skip anatomy. So many people have like they're discussing to leave anatomy and study more gynecology, include all those questions, or else if we have got a burden with nine chapters for the veterinary science stream, skip anatomy and study the rest, you will get good marks. Like it's not true because anatomy yearly they are asking about 15 questions. That is, a question will be having 4 mark, 15 into 4, that's actually 60. It's a very good mark. And studying anatomy is actually much better. But after the 4 years of these academics, we will find it hard to revise those anatomy. But whenever you are studying reproductive anatomy, combine it with gynecology so that it will be very easy for you to learn and make short course. Now, combine pathology, microbiology, preventive medicine, and BPH. Because pathology, microbiology, preventive medicine, and BPH, we have got some diseases. So combine all those things and study those things together, and we have to cover all those things under an umbrella. Like whenever we are dealing with any of the pathogens, that is bacteria, we have to study the microbiological aspects of that bacteria. Or whenever we are going to study the microbiology or the features of any virus, we will go to pathology section and microbiology section. And whenever we are also going to the parasitology section, we can also connect it with the vectors and something which is related in the mechanical host transmission and all in the VPH also. So moving to the analysis section, actually in this year we have had combined with VPT and VPA, that is third year, we have got nearly 38 questions. It's like nearly 40 questions. We have got 38 questions, and that is actually 1 by third of 120. Yeah, whenever we are completing pharmacology along with parasitology, we will be getting nearly 35 to 40 questions. That will be very easy for you to score a much good medal mark. And see, whenever you are covering the 4th year syllabus, that is surgery, medicine, and gynecology, you will be getting nearly 35. That is, every year they are asking minimum 11 questions from each of the subject. That is, 11 from surgery, 11 from medicine, 11 from OG. So minimum 33 will be there. But sometimes they will be asking much more questions from surgery and medicine. Like they will be having nearly to 35. So next is actually micro, patho, VPH and all. Like combined, they will be asking nearly 30. That's 1 by 4 part of 120. So if you are studying VPP, that is pathology, microbiology combined with the parasitology and also the veterinary public health and all, you'll be getting nearly 30 questions. See, it's a very huge. From two subjects or 3 subjects, you are getting 30 questions. And veterinary anatomy in 2020 second entrance and 2021 entrance, they have asked nearly 17 to 20 questions from the anatomy section. 2022 it was like 17, and in the 2021 section it was nearly 19 questions from the anatomy it was there. So 1 by third, that is actually VPA and VPT, that is third year subjects, and almost 1 by third, that is having final year subjects. So whenever you are studying for the ICR 2023, keep it in mind. Thank you.